is Hannah. I'll be your nurse today. Please state your full name and date of birth.
Rose Finke, 12/5/2000.
Okay, great. This is the correct patient, and my patient is alert and engaged. Can you tell me where you are?
The hospital.
Can you tell me where you're here?
Focus assessment.
And can you tell me today's date?
October 31st.
So my patient is oriented to the person, place, time, and situation. And today I'll be performing a focus exam on you today. It should take between 8 to 10 minutes, and I'll explain the exam as I go along. Please feel free to stop me at any point during the exam if you feel uncomfortable or have any questions.
Okay.
So my patient understands the purpose of the exam. And before we begin, can you please empty your bladder and put this down on what ties in the back? And then close this curtain for you. Are you comfortable in this room with respect to warmth and privacy?
Yes.
So my patient is prepared for the exam and comfortable within her surroundings. So I'm going to start by asking you a few questions. Have you experienced frequent headaches?
No.
Any muscle weakness, numbness, or tingling?
No.
Any problems moving about?
No.
And any loss of consciousness, fainting, or not knowing where you are?
No.
So my patient doesn't complain of any neuromuscular deficits, but if she did or had any concerns, I would assess them using Olcott size and further assess them using special age-appropriate assessment tools. So my patient can answer questions appropriately. Her speech is coherent, at an adequate volume, with variations in tone. Her voice is clear and free of stutters. You can just stand up for me and walk normally to the edge of the rug and back. Okay, and you can sit down. My patient maintains upright, balanced posture while walking unaided with opposite arm swings. And and so now I'm going to ask you to cover your right eye with your right hand. I'm going to do the same thing with my left, and tell me when you can see my finger.
I can see it.
Okay, my patient's peripheral vision matches the examiner's. And now I'm going to ask you to focus on a point in the room, and I'll shine my light in your eyes. Okay, corneal light reflection is in the same location, equal and bilaterally. And so pupils are equal and round, and if you can focus on a distant point in the room again, I'm going to shine my light in your eyes and just maintain focus there. Okay, my patient's eyes or pupils reacted direct and consensually with responses. And if you could focus at the tip of my pen light and focus when it goes on. Okay, eyes accommodated. And you can focus on the tip of my pen light again, only with your eyes, and do not move your head. Okay, eye tracking is smooth and coordinated. And so now I'm going to ask you if you could clench your jaw and grit your teeth. Okay, my patient performs movement as instructed. And can you raise your eyebrows? Can you close your eyes tightly? Can you purse your lips? Can you puff out your cheeks? Can you show me your teeth? And can you smile? Okay, my patient performs movements as instructed. And so can you say, ah, for me? Okay, there's symmetrical upper movement of the soft palate and uvula. And can you shrug your shoulders resisting my force? Okay, my patient can shrug shoulders. Movement is smooth, equal bilaterally, and strength is 5 out of 5. And can you stick out your tongue and move it up and down, side to side? Okay, my patient's tongue is symmetrical and movement is smooth. And could you stand up for me? And walk heel to toe like this for me to the edge of the rug and back. Perfect. My patient is able to walk and maintain balance. Foot positioning is maintained. And could you stand with your feet together, your arms by your side, and your eyes closed? Okay, you can open your eyes. Upright posture is maintained with a slight sway noted. And if you could stand like you are with your arms out to your side, touch your nose with your index finger and close your eyes, and do it with opposite arms. Okay, perfect. And you can sit down for me. My patient was able to touch her nose, alternating arms in a rhythmical movement. And now could you take your right foot, or your right heel, and drag it down your left shin for me? And same thing with the other leg. Okay, you can sit up for me. My patient was able to drag her heels down her shins purposefully. So now I'm going to test your sensation with a little cotton ball. It feels like this. If you could just close your eyes and point to where I touch you. Okay, great. My patient can indicate touch accurately. And I'm going to do the same thing with a Q-tip I have broken in half. There's a sharp side and a dull side. You can just close your eyes and indicate which side is sharp or dull.
Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull. Dull.
Okay. My patient is able to indicate sensation accurately. And now I'm going to take this reflex hammer and test your reflexes. The important thing is to just remain relaxed. Okay. Bicep reflex is equal at 2+. Brachioradialis reflex is equal at 2+. Patellar reflex is equal at 2+. Now I'm going to test for Babinski's reflex. Okay, and Babinski's reflex is present. Is there anything I can do today for you before doing the safety check?
No.
Thank you.